Well, COVID-19 has disproportionately impacted minority communities. So now that the vaccine has arrived, you'd think it would be one of the first places it's deployed. That is not the case. In fact, as Business Insider just reported, so far the vaccine has primarily been available in white communities. This morning, we want to break down some of the reasons why. Here with some answers is healthcare and business analyst Seth Denson. Seth, good morning to you. I appreciate you breaking these complex topics down for us.
Always good to be here.
Let's start with the first reason here, and this has to do with the relationship between the African-American community and the medical community as one of the reasons why. Can you explain that for us?
Yeah, I think you referenced the Business Insider article and the study that's being done there. I want to preface this by saying that this is somewhat premature and that the data is about 60% unknown. That being said, we have systemic problems in our country as it correlates to not only demographic challenges, but socioeconomic challenges in African American, Black, Hispanic, Native American communities. And that's something that has been going on for decades now. And I think that what we're seeing in the vaccine rollout and maybe the lack thereof of it getting properly to these parts of our country is a large part a derivative of those systemic issues that have been around for years.
One of the issues with the Pfizer vaccine, which is the most available for really Americans at this point, as we are in the initial stages of this rollout, is the way it needs to be stored, and the fact that maybe some of these facilities, hospitals in mostly African-American communities, minority communities, don't have that storage easily available. Can you elaborate on that?
Yeah, so these ultra-cold storage requirements as required by the Pfizer vaccine and even in some ways by the Moderna vaccine, these facilities themselves are rather expensive. And we're talking $10,000, $20,000 per unit if you can get your hands on them. And what's happening is, and what we're seeing here, is that many hospitals in urban areas which rely heavily on government funding and government reimbursement, not as much on private pay reimbursement, just aren't investing the dollars into getting these types of capabilities. Now, interestingly enough, the CDC actually came out last year and encouraged these urban-based hospital systems not to invest, to utilize those funds in other areas to serve their communities as other vaccines would soon be rolling out. Unfortunately, though, right now, we're just not seeing that as the case.
And Seth, I want to go back to an earlier point that you made as far as us still being in the early stages, and there's still a lot of data that's not available. We do know that for Virginia especially, they're still in the early stages of this rollout. But in the early stages of this rollout, you're talking about nursing homes, nursing care facilities, things like that. And there's also a disproportionate number of white patients versus Black patients, and that also has something to do with this.
Yeah, again, going back to the statement I made on socioeconomic challenges and issues, really you have to recognize, and this is why I said let's be cautious of getting too ahead of the cart, ahead of the horse here, is that, as you start to think about who is able to get the vaccine, well, it's the 1A group and the 1B group, 1A being frontline workers, healthcare workers, which proportionately are largely consistent with white communities and have a higher white population. And then the second is long-term care and nursing home facilities, which also have a higher white population. Now, here's going back to the thing I said earlier, though. This is a result of socioeconomic issues and a systemic problem that we need to address in the country. This vaccine is just a derivative of that.
So now, Seth, let me ask you this, because you say, obviously, this is a systemic issue, things like that, which goes back decades and decades when it comes to the resources African Americans, minority communities have versus white communities. Is this something that can be fixed now? We're in the midst of this rollout, which just in general, logistically, has been a nightmare. Is there any way to fix this?
In the short term, the only way to fix it is through government intervention. That's the reality of the situation that we're in right now. We need more funding for these areas so that they can get this vaccine more appropriately rolled out. But we also need more education in these areas. Statistics are showing that in the Black community specifically, 1 in 3 persons of color do not want to take the vaccine. And I think that's a lack of information. We need to invest heavily in information, but also invest heavily in getting this vaccine into these areas.
And that's 1 in 3 in the Black communities versus 1 in 4 in white communities. So there is a big difference there, just
Correct.
So that people can have some perspective. Is there anything in the works now in order to address that lack of trust and so forth?
We're not seeing a lot there. I mean, Congress has had so much infighting, and there's been a disconnect between both federal and state governments. And so my hope is that a new administration comes into power in the days to come, that we can get past the politics of this vaccine and get into the practicality of getting it rolled out, and we can get to work on doing what we need to do.
Okay, Seth, thank you very much. His information's on your screen there if you want to follow him, especially on Twitter. I know you always offer up some pretty good tips and information on your timeline. So we appreciate your time this morning. Thank you, Seth.
Thanks for having me.